Most people will come to see us with a diagnosis of an acoustic neuroma because they originally had some hearing loss, but it was just in one ear, or it was much more severe in one ear than the other. So by far, that's the most commonly presenting symptom for an acoustic neuroma. Some people have increase in general dizziness or balance problems. More uncommon would be things like facial paralysis, facial numbness, headaches. Many people, though, have no symptoms at all. These tumors are picked up by an MRI scan that was done for a completely unrelated reason. The hearing loss from an acoustic neuroma will typically affect just one side. So any degree of asymmetry, so hearing better on one side or the other, is something that often brings people to the ear doctor. And if that difference between your ears is big enough, we might do an MRI scan to investigate if you have an acoustic neuroma. Usually an acoustic neuroma will only affect one ear. If tumors were very large, there's a chance that it could affect some functions on the other side, but typically an acoustic neuroma will only affect functions like hearing and balance, facial sensation, facial movements on the same side of the body that it's on. Acoustic neuromas can cause hearing loss in one ear, and with that hearing loss, people will often experience tinnitus, or the perception of a sound, a ring, or a buzz in that same ear where they have hearing loss. Because your inner ear is also for balance, acoustic neuromas can affect the inner ear function for balance, meaning people feel just generally dizzy, off balance. Less commonly, they'll have vertigo, or a perception of movement or spinning that isn't really happening. And these tumors, they grow also near the nerve for moving your face and sensation on your face. So rarely, but when these tumors get much larger, people can experience numbness on the same side of their face, or even twitching or weakness on that same side of their face.